Coming up next on Democracy Does, the Civic Power Playbook.
How do you feel as a medical professional who is watching advances in science get rolled back?
That's true. You're going to have children that will suffer severely and adults.
That's up next. Welcome to Democracy Does, the Civic Power Playbook, a podcast that cuts through the noise to explain what's really happening in our democracy. Each episode breaks down key issues with insight from policy experts and change makers, giving you clear tips to take action. Whether you're fired up or feeling stuck, you're in the right place to get informed and get inspired, because democracy works best when we all participate.
Hi, everybody, and welcome back to Democracy Does, the Civic Power Playbook. I am so excited today to have our guest. I say that about so many guests because there are so many people doing great things, but this guy is incredibly special because I'm a little biased. He is my cousin, but he's also an accomplished public servant, a dentist. He's done a lot for community health. His name is Dr. Wenzel Carter, and we're thrilled to have you. So thank you so much for joining us.
Sure.
Tell us a little bit about your career. Tell me how you got started and who is the population that you serve.
I got started, I guess the very beginning of this was in college when, junior year as a biology major, what's next?
Mm-hmm.
And friend and upperclassman said, well, you want to go to dental school, because she was going to go, and she did, to University of Pittsburgh. So I applied and got accepted to University of Maryland. The College of Dentistry is in downtown Baltimore.
Uh-huh.
It is one of all the University of Maryland professional schools are in downtown Baltimore. So I started there and finished in 1980.
Okay.
From there, I worked for a bit as an associate in offices around the city. But what they didn't teach you in dental school was, you learn the science and the art of dentistry, but they don't teach you the business part of dentistry. And it's really as much a small business as it is a medical science. You've got to know how to set up an office. And I think the way things were back then, I think the expectation was that you would graduate from dental school and join your father's practice or your uncle's practice or some member of your family. But for first generation practitioners like me, there was no relative to help me get started along the private practice route. So I had always had an interest in the military because my uncle was a Tuskegee Airman. He trained, he never deployed, but he was. So I was fascinated with planes, model planes and stuff, because his picture was around my aunt's house and I could see him in his flight suit. And I thought, well, this will be a pathway to maybe a dream career. I didn't think I'd make it as a fighter pilot, but in the military, you just get to practice dentistry. You don't have to worry about hiring people or setting up an office, renting space, and buying supplies and insurance and all the things that a dentist in private practice has to be concerned with.
I think that's really important and fascinating that you mentioned that, because nobody talks about the infrastructure and the legacy that comes when you're taking over someone's business. And it makes all the difference in the world when someone is handed a business or a business is passed down from one family member to the next. That makes all the difference in the world. And hearing how your military service converged with your passion for dentistry is fascinating, because it dovetails perfectly into how you ended up serving the people that you ended up serving. So what steps happened after that?
I did 5 years active duty. I went from Baltimore to Strategic Air Command headquarters in Omaha, Nebraska. And then I did a year in South Korea, finished my active duty career at Andrews Air Force Base, and then again back to private offices for a bit. And then I moved to New York State where I met my wife, Marjorie, who is your cousin.
Yes, yes, that little piece of trivia.
Yes.
Okay, so after the military, I guess I should say, you did your tour, and then can you talk to me about the populations that you served?
Yeah. When I moved to New York State, I was a contractor for an active duty base, but then for the next 23 years, I worked for New York State government, first in a medium security prison and then in a psychiatric hospital. And that was exposure to a population that most people would think, oh my God, how could you work there? It's terrifying. But we got along quite well. As a matter of fact, I've got a folder of fan mail from my former patients in the prison, and they appreciated what we provided for them.
Yeah.
But it gave me an exposure to people in prison aren't necessarily bad people. They're people who haven't had the opportunities that most of us have. A family that's intact, a complete education, and you fall into bad company and things snowball
Mm,
and you end up incarcerated. There's a lot of smart people in prison, a lot of talented people in prison, but they need a reset of their life and their values, and they deserve a chance to get out and start their lives all over again.
mm. I love that you saw them in, the people that you serve in a different light, because I think so often there's this attitude that what you do, you go in and it's strictly transactional. But the fact that you were able to gather that from the interactions that you have, plus, I don't think I've ever sent my dentist a piece of fan mail. So dentists usually don't get fan mail. So,
No, we don't.
yeah.
It's nobody's favorite destination.
When we're talking about the dentist isn't always people's favorite place to go. One of the reasons why I wanted to talk to you today, not only because I rarely ever get to talk about what you do or what you did your past career, but we had a really interesting exchange about how people view going to the dentist. So often it's an add-on, but it's critical to people's health. And there have been a lot of changes that have been happening with legislation in terms of a lot of people are calling it the big awful bill, because there are people who are going to be really harshly impacted by the cuts that are made. And one of the things I noticed is that with the cuts to Medicaid and Medicare, there are going to be cost sharing measures that are going to make it difficult for people to afford oral health care. So I wanted to get your perspective about what do you think the impact that will have on people, specifically middle to lower income populations that you have interacted with?
Because of the way medicine is structured, and I'm including dentistry as a part of medicine because it is. I mean, your mouth is the beginning of your digestive system.
Mhm.
And because historically it's been separated from your medical care, if you don't have dental insurance, you're basically in a bad way because now it comes to pay for dental care, it becomes a discretionary expenditure. So you got it, money that you would ordinarily have for vacations or a larger expense because dentistry is expensive, you would have to use that money to pay for dental care. And for lower income people on Medicaid, the cuts will be devastating. And I'm thinking about in areas where you're not in a big city. So most dental schools are in big cities. That's where universities are. And in the deep South, for example, where you're not near big cities, it's going to be very bad because you would have to find a dentist that would take Medicaid if it still exists. And then private practices are very spread out because you need a critical mass of patients to make a private practice work. So it's going to be very bad, especially for children. I'm thinking about the intersection of lack of access to care and our diets, which are loaded with sugar. And for a child that eats sugary cereal and a lot of prepared food, they're going to develop cavities, and uncontrolled dental decay in a child can be life-threatening. There was a case in Maryland of a child that on Medicaid whose mother could not find an office to treat him, and he died from a toothache.
How did he die from a toothache?
It was an upper tooth that was badly decayed. His mother took him from office to office. None of the places she took him accepted Medicaid reimbursements, which are not as good as dental insurance reimbursements. It got to the point where the infection from the tooth spread to his brain, and he died from the infection. His name is Diamante Driver. You can find documentation of that on the internet, but his death prompted changes in Maryland that we're very fortunate to have here. There is a group that advocates for low-income patients called the Maryland Dental Action Coalition, and they tried to expand Medicaid coverage for low-income people and even now for adults. I was privileged to work with them lobbying the state legislature to pass Medicaid benefits, Medicaid dental benefits for adults in the state of Maryland.
Congratulations, because that is the type of advocacy that people don't even realize needs to happen behind the scenes. And I want to circle back to how you ended up doing that, because after your stint in New York working for the state of New York and the prison system as well as the psychiatric hospital, you came down here and you worked for Montgomery County. Is that
Yes.
correct? And that's where you saw a range of clients or patients from various economic backgrounds, specifically middle to lower. Is that accurate?
Yeah, that's exactly true. Montgomery County is, for those that don't know, is the largest and wealthiest county in Maryland. At the time that I joined their public health dental program, they provide care for low-income patients that don't have dental insurance or have inadequate dental insurance. And that means coverage for children, which is critical because if they have dental decay, they're not going to be able to eat well. They're not going to be able to focus in school. So that has an effect on their academic success. For adult populations, you have to be able to get a job, and you want to go for an interview and be able to present yourself in a way that makes you acceptable to a potential employer. I had patients who actually were in tears because they were ashamed of their appearance, because they could not afford dental care, so they could go and get a job and then possibly get dental insurance and take care of the remainder of their needs. We also served seniors because after your working days are over, your dental insurance may have been tied to your employment. Once your employment ends, you have no dental insurance. And we provided care for seniors in Montgomery County too.
Certain parts of the population, they're going to be really hurt. What do you see in terms of the future for patients, middle to lower income patients? You mentioned children. What is it going to mean for adults who are on Medicaid, for example, and have to make a decision between groceries and the light bill or dental work.
I'm not a politician, but public policy should be in a democracy for the common good. And if you're going to make cuts to healthcare programs, public health programs, to provide tax cuts for the wealthy, that's not right. It's not what I feel this country should be about. You may have been unhappy with an administration that didn't do what you believed was correct, but what you've got right now are public policy in terms of taxation that favor the upper class at the expense of the lower class.
And that's another point of contention is a lot of people feel like our priorities are a bit skewed, because that leads me to another point that's happening in terms of what's protecting the public or not. And that's the head of DHHS, Robert Kennedy, who wants to remove fluoride from the water. And I wanted to know what your concerns are about that.
I was always interested in science, and there is such a thing as a scientific method, in that if you are working on a theory about a physical problem or chemistry or whatever, you do experiments to determine what works and what doesn't work. Robert Kennedy is not a scientist. He's not a physician. He has no scientific background. I think his beliefs are based on anecdotal evidence, which may be right, may not be right. In this case, he is absolutely wrong, because fluoride, for whatever you think, and there has been an anti-fluoride element in American society for a long time. Whatever you think, it has been scientifically proven that fluoridation protects you against tooth decay. Fluoride in public drinking water systems bonds with your enamel to make it less susceptible to the acid in the foods that we consume on a daily basis. What am I talking about? I'm talking about sodas, sugary cereals, treats that are sweet and sticky.
Mm-hmm.
In your mouth, the bacteria convert the sugar to acid, and the acid dissolves tooth enamel, and that's what a cavity is. That's what a cavity is.
And fluoride helps, you said, bond to the
fluoride bonds to the enamel and mitigates that, or slows that process down to the point where children in areas where there is no fluoridation. I've met colleagues and friends who lived in areas where there was no natural fluoridation or public water system fluoridation. They got a mouthful of fillings because they had developed a mouthful of decay because they didn't have the fluoride to protect them. There is one of the newer treatments for decay in children. And I want your viewers to imagine a child who's been in pain, who can't sleep because of the pain, coming into a dental office. There is a non-traumatic way of treating those cavities that a child may be able to tolerate without giving them local anesthesia and using the drill, which nobody likes that, but it's especially difficult for a child. But this newer technique will enable a dentist, hygienist, or a dental therapist to treat tooth decay and get the child out of pain. And it has fluoride. It's a concentrated form of fluoridation that kills the bacteria causing the cavity.
How do you feel, just this is a side note, as a medical professional who is watching advances in science get rolled back by someone who is not qualified or knowledgeable about these issues? It's going to cause serious harm on people that you would have seen, if you were still practicing.
That's true. You're going to have children that will suffer severely, and adults, because of lack of fluoridation in their drinking water. The senior public health officer in Florida is also an anti-vaxxer. He's against vaccines,
I saw that.
which again is proven science. We had during World War II a president, Franklin Delano Roosevelt, who suffered from polio because there was no polio vaccine to prevent him from becoming, the term used then was crippled. He could not walk. He had braces on his legs, and he was lucky to have lived through the disease. It actually shortened his lifespan. But polio was rampant back then because there was no effective treatment for it. It's caused by a virus. But Dr. Jonas Salk developed a polio vaccine, and the rate of polio in the United States plummeted down to the point where it became non-existent. It's the same for measles. It's the same for it was true for the coronavirus.
Mm-hmm.
The vaccine worked. If we had 1 million deaths from the coronavirus until the vaccine, that slowed the progression of the pandemic to the point now where, do we still have pockets of COVID? Yes, but it's drastically reduced.
Let me ask you this, how do we move forward? Because one of the things I want this program to do is to encourage people to feel empowered and educated so that they can make choices to prepare themselves, brace themselves, equip themselves with ways to live as well as they can in the current circumstances that we have. So for you, as someone who has worked in community health, you know the importance of dental health, and you know of resources. We call this our power play. What are 3 top power play tips you would tell someone to do?
Just in general, for what we just talked about, part of the issue now is where do people get their information?
Mm-hmm.
Do they read and access unbiased scientific information, or do they get their information from a single media source that has an agenda?
Mm-hmm.
And I would submit that people need to get their news and information from a variety of sources, not just one, and learn about what's true and what isn't true.
Mm-hmm.
So you've got to understand and trust your physicians, trust your dentists, and your state public health officials.
Mm-hmm.
That's where the accurate and unbiased information comes from. Every state has a health department. If you have any doubts whatsoever, you should place a call to them or access them somehow through hospitals or the internet,
Mm-hmm.
and find out what the truth is, because the consequences of not having good information today, especially when you've got unqualified people making public health policy, the consequences could be life-threatening, pure and simple.
And what is another recommendation? For example, if, say, you live in a place like Florida, or you are in a place where maybe you don't have community, you're not close to a place where you can get community health care. Is there something that someone could do just on the day to day? What if you have limited means, limited access? What can someone do? Let's just even start with the basics, just in terms of taking care of their mouth.
That's difficult because you've gotta educate yourself, good nutrition, good oral health care, frequent brushing, avoiding beverages and food that are high in sugar and carbohydrates. One of the things that I tried when, well, we were successful at one of the clinics in the Montgomery County system was, if I saw patients with gum disease, I refer them to the co-located medical practice that was in the building. And what I wanted them to do was, when they had patients that were diabetic, to refer those patients to the dental program, because chances are they were diabetic. And I was making the medical referral because of the potential of patients with periodontal disease, gum disease, to be diabetic. So we've got to educate physicians to have them more aware of oral health. Dentists need to be more aware of what we call systemic health, the rest of the body, and just work together to keep patients as healthy as possible.
You had said in our earlier conversation before this was a couple days ago, that diabetes is an indication of gum disease and gum disease is an indication of diabetes. Yes. So you had mentioned that the two really are related. In your referral, was that a way of letting somebody know, hey, you're going to be affected in totality if you don't get this taken care of? I mean, was that a way of kind of taking a more holistic approach in terms of somebody taking care of themselves, or am I reaching here?
No, not at all. And that goes back to what I mentioned before. Your mouth is the beginning of your digestive system. And what is the relationship between gum disease and diabetes? The relationship is, gum disease is caused by bacteria, and bacteria causes inflammation in the mouth. That's what gum disease is. You get swollen and puffy gums that bleed readily. The toxins that bacterial population produces goes into your body and goes through your bloodstream, and it makes diabetes worse, because now you're fighting two things. You're fighting the resistance your body has to glucose and sugars. The inflammation from the bacterial toxins is just another burden on your immune system. So with that inflammation present, if you've got diabetes, your blood vessels in your gums are less able to combat the bacteria that causes gum disease. So it's kind of a circular, self-perpetuating problem.
And you saw, oh, go ahead, please.
Oh, yes, we saw a lot of that, because a lot of the patients in the Montgomery County Public Health System are new immigrants to the county and the United States. They never had access to dental care before, and everything we did for them was kind of new. They just never had. I had patients who had never had local anesthesia for a filling or restoration, as we like to call it. They had never had their teeth cleaned as adults. And the education process is, you can't just treat the specific problem. You have to educate people so that they can not only continue with their oral health, but their systemic health too.
Mm. The whole point is we want to prevent people from falling through the cracks. What would you say for people just in other states? Would you say just look for, go to their human health and human services agency?
If you live in a big city, in a larger city, or within commuting range of your state university's dental school, that would be a great place to start.
Okay.
A couple of the resources we talked about before was, here it's Howard University Dental School. There are students there, and you may think, oh, I don't want to get treated by a student. But what people may not know is that every step of everything a dental student does is supervised by an instructor who is a dentist who has completed academic training for within their specialty and for education. So that's a great place to begin, that you get is prolonged care because you've got a student who's learning, but it's excellent care because the student's doing it for a grade that they need to complete procedures for to graduate. So
is it free?
It's not free, but it's lower cost than a private practice because it's a dental student, not a dentist in private practice. So the cost of renting a space or purchasing your building, buying the dental chair and all the equipment, the staffing, and supplies, all of that's covered. So you're just basically paying for the care itself, stripping out all of the other expenses that a private office has.
Mm-hmm.
Free clinics called periodically, you will see, I would Google Mission of Mercy clinics. They're done periodically in Maryland and Virginia that I know of, where people can come for emergency care and some basic services. Mission of Mercy clinics.
Okay, that's excellent. Is that only in the Maryland, Virginia area, or do they?
I hope not. I know that I'm for a fact I know Maryland and Virginia, very possibly in other states.
That's really helpful. So those tips again, first of all, just ask questions, ask your dentist, doctor for information. Go to your local health department, good nutrition, and then university dental schools and free clinics
Yes.
are good places to go. Okay, that's very helpful.
In some states, it may be the case that your pediatrician can apply fluoride to your child's teeth. That's one area where the intersection of medicine and dentistry may be working in different locations because there's a growing understanding within the medical and dental communities that we have to work together. And they want to prevent the case that when your child gets a toothache, they have to go to the emergency room for care, which the emergency room is not equipped to provide dental care. They can give you antibiotics and pain medication. They can take x-rays, but that's it. That doesn't solve the problem.
And by then, if they're going to the emergency room, isn't it
You're in
almost
trouble.
too late? Right. Yeah, it's
late.
almost too late. Okay. All right. Finally, how do you stay hopeful? Because this is tough. I'm sure it's very painful for you as someone who has been such an advocate for community health, for people's health, public health. How do you stay hopeful during this time?
I think now it goes back to something I mentioned before. In the Air Force, to progress through the ranks, you have to study. And one of the studies or courses that I did that was unrelated to dentistry was there is such a thing as Air War College, and you study tactics and military history. And a component of military history is information warfare. And I think when you have people in positions of power now that are giving information that is flat out false, that's a form of information warfare. So I think people need to arm themselves with the facts, and programs like your podcast and maybe things on public television or documentaries that a news service may run. You've got to know where to find the truth and information for resources to help yourself.
Thank you, Dr. Wenzel Carter, for
Thank
being
you.
on this show. And every little bit matters.
Thank you.
Yeah, absolutely.
Have a great day.
Let's recap. Here are Dr. Carter's top power play tips. First, ask questions, whether it be from your doctor or a public health official, especially if you hear something that just doesn't quite sound right. Also, be vigilant about your health and nutrition. Every bite matters. Also, if you're in a bind, check out resources at your local university or dental school. You may be able to get some type of services at a discounted rate. Oh, and here are some other services that might help you. If you're in need of a clinic but just not sure where to go, check out findahealthcenter.hrsa.gov. And if you're really in a crisis and you need to get some emergency dental work done, check out emergencydentist.usa.com. Thanks so much for joining us. We hope you're feeling a little more hopeful, a little less stuck, and maybe even inspired to take action, because democracy does work when we all participate. And don't forget, sign up for our newsletter to get updates on when our next episode drops. You can go to my website, democracydoes.com. And as a bonus, if you haven't gotten one, a free and easy tip sheet on how to get involved. Until next time, I'm your host, Robin Hamilton.